Anup Kumar sir, you welcome
Okay,
and
sir.
Surendra sir will
Yeah.
take the class.
Okay, sir. So, good evening, everybody. I'm welcoming all to our today evening's program. Surendra, sir, I request you to take this session forward, sir. Thank you, sir.
Good afternoon, good afternoon. Last two classes I've been telling about the pain management. Pain management is now a latest subject and a new caption they are given. And of course, the therapy has been diverted,
Bharan, sir, you can
differently
switch off
diverted.
your mic.
So, you know coccyx. Coccyx is composed of 4 or 5 rudimentary vertebral fused to form one bone at the end of the vertebral column. Just curves like. It articulates above the sacrum. This is a sensitive place where most of us are likely to get pain due to damages or many infections or something like that. Generally, sensation of weight and feeling at the coccyx. You feel sensation, not actual weight, sensation, as if it is hanging down. Antim-torque is the best medicine. You know, most of us have got the itching in the coccyx due to many reasons. Many reasons. Bovista is the best medicine. Burning of the coccyx on touching it, when you touch it, you feel the bruised and burning sensation. Carbo animalis. Bruised pain in the coccyx. Coccyx. Causticum. Pain like electric shock. See, even in the nerves, sometimes you'll get that feeling, that electric shock, like. For that, euphorbinum officinalis. Pain on account of fall or injury in the coccyx, hypericum. Arnica also helps. Pain in the coccyx while sitting, chalybeate. Pain in the coccyx and the sacrum works from rising or from sitting position. Whenever you move, you want to move, you feel discomfort. Laxus is the best medicine. Ulcers at the end of the coccyx. How do I know, sir? You feel the bruised feeling or ulcers, inconvenience paining, and whenever you move the coccyx and the tissues there, you feel somewhat inconvenient pain. That's called ulcer. Pionia is the best medicine. Sensation of pressure on the coccyx. Silesia. Pain on a hard surface and keeps a cushion below while sitting. Pain in the coccyx all the time. Xanthia. Numbness in the coccyx. Platina. These are the best medicine. Single medicine. Of course, they are very effectively remove your problems. Yes, I go to some other topic. See, you got a tendency to bite the lips or the finger tissues or sometimes even the bone or the fingertips, etc. It's all there. It starts from the childhood. Irresistible desire to bite gums and teeth together. Sometimes either gums or teeth. You put your finger there or you bite the skin, as the case may be. Phytologha is the medicine. Irritable feeling under the fingernails relieved by biting them. By biting the fingernail, the irritableness is overcome. That is ammonium bromatum. We should not bite the fingernails because they are poison. If they enter slowly, the stomach gets upset or stomach gets ulcerated. That is why we advise children not to bite the fingernails. Biting inside the cheeks while eating or biting the tongue while eating. Like that. Ignatia is the best medicine. Biting of lips, biting of fingers and nails. I already said Phytologha, that is gums and teeth together, etc. Biting lips and biting the fingernail, aurum triphylinum. Biting cheeks and tongue while eating, causticum. So these are the so simple medicine, but they come very useful for us in our career because if you go on biting the lips and cheeks, etc., it gives a very ugly shape. Very ugly shape. Not only that, it may turn to ulcerated condition, septic condition, thereby you may get fever and other disorders, etc., etc. What can be avoided is a good thing for health, good health, etc., etc. Yes. Now, I got a very small topic for you. Small topic. Health benefits of rice water. Rice is a good one. Of course, it is the backbone or the back thing for all the types of foods that you prepare. That is basic thing. You can put pulao, you can say fried rice, and you can say many things. You can add with vegetables, sambar, add with curry, etc., etc. That is our traditional way of life. Taking rice is the throughout the India you can find, etc., etc. Of course, in neighboring countries also rice is there, But when go to the western side or eastern side, you can say Singapore, Malaysia, everywhere, Thailand, Bangkok, etc., etc. Everywhere they got rice basis, but their additions and tastes are entirely different. Entirely different. Not like ours. They don't add chili powder or the tamarind powder. They don't add it. Ayurveda has got a preference for Navara rice. Navara is a good quality which is called Sastik Sali. It was very quickly grown within 60 days. It is unpolished rice and reddish or brownish in color. The authentic treatment in Ayurveda is the Charaka Samhita. In other words, the rice called Sastika Sali, which is very good for our body. While we were depending only on rice, the following statement will give you a enlightenment. It nourishment to the whole body by producing dhatus or energy to the tissues, to the blood, bones, muscles, reproductive tissues. Also balances all the three doshas, Vata, Pitta, Kapha, and is highly beneficial for people of weak and undernourished. So this statement will give why we were depending only on, but this variety of rices, production of rices, giving name, this IR8, this, that, understand, they all have, by using fertilizers, they all have diminished the value of the rice. It has nothing. What we eat as a background for food is not at all good. Not like this. It will not help any part of the body. Only fills the stomach, that's all. But added dal and vegetables give us relief. Cooked rice is called anna. See, there are many ways of preparing it. We are not concerned about it. If the rice is slightly fried before cooking, it helps in the throat disorder, anorexia, disorders arising from imbalance of kapha and chronic indigestion. It's like frying of the rice and then cooking it. If the water is used for cooking rice is used for several times, by adding hot water, the rice becomes very slight and it is easy for the digestion and recommended for vata disorders, anorexia and nutritive diuretic nature. See how the rice, very rice, prepared in different forms, helps us in curing different anomalies. See, boiled rice without draining is called apsarta adata, which is sweet in nutritious condition, which is heavy to digest. Recommended for emaciating disorders. Sometimes what happens is modern days, they cook the rice, keep in the cooker, take it next day, use it, mix it and take it. that is considered to be not at all healthy and good. It aggravates the tissues, worsens kapha, increases all three doshas, vata, pitta and kapha. All right. When rice is mixed with vegetables, tuber, that is tuber means carrot and other beetroot, roots, or oil and or ghee, milk substances, pulses, etc., it gives a different energy and taste. In Tamil, we call it kadambam rice. That is, put all vegetables. They all do it on a Amavasya day or an occasion, where you take in the morning and you undergo fasting, or on the days where you Pitta Tarpanam, on the yearly ceremony, you give to the parents. On that day, you take only food in the morning and you forgo till night, and you may take fruits in the night. So this is as a remembrance. There they prepare this food like this, because this one dose in the morning will keep you throughout the day. Like that, rice has got many things. Wonder water. We pay little attention to the water used to wash the rice. See, washed rice, that is called, mixed with this, what is called the dust, or forgot the right word, the rice bran, powder. So that must be clean, and that water should be filtered, and it can be used for many remedies in Ayurveda. For women suffering from menstrual disorder, leukorrhea, and rice water gives amazing results. Diarrhea, burning urination, bleeding disorders, heavy periods. Rice water also reduces burning sensation in the palm and the soles. Rice water is laden with many minerals, vitamins, and astonishing results for a kid. See the importance of rice. Why India was traditionally a rice eater. This gives us, because we don't know. What we know is go to the shop, get the one rice bag full. Previously, you used to get 100 kilos. Then it becomes 75 kilos. Today, 25 kilos, 5 kilos, 10 kilos bags are available. Understand? And what rice it is? Of course, according to taste, we take it. What is the energy they have got? Nobody knows. They put some printing on the bag, because as per the government orders, they have to put what is the content. All those things. It is important to know the benefits of rice, the right way of cooking, and the benefits to be used in a simple manner and effective manner. So this is how we have a traditional way of rice being used as a healthy, not only that, curative also. Not only energy to the body, curative also. According to the period, according to the circumstances, according to the contingencies, we change the method of cooking the rice. Okay. Thank you. I think this would have been given you with a good much review. One more thing I want to tell you now. One simple clue, particularly for old age people. When you go to the bathroom, don't shower and put shower water into the head at first. That is very bad. That gives sudden blood flow to the brain, and then there is the possibility of paralysis or other disturbances to the body. That is why, according to the old system and the Ayurvedic system, one has to first put water in the legs slowly he has to upkeep it. Here, one thing you know, previously we all used to take bath only in the rivers and running waters. What we do, we slowly get down. When we slowly get down, things goes up from bottom to the top. Lastly only we dip ourselves. So that's how you see everything is in India, in our ancient culture. Everything is methodical, not symbolic. Everything methodical, everything good for our health, everything is useful for our upkeep, etc. etc. I think this step should have helped you much. Thank you. Over the pocket.
Thank you, sir. Thank you, sir. Murthy, sir?
Is my voice audible?
Yes, sir. Yes, sir.
Namaste, my dear homeopaths.
Namaste, sir.
Thank you very much, Surendra sir. Good, so many things. Our traditional values you have given in lecture. Thank you. The last few months we have taken excretory system, in that urinary system, in that we have taken bladder disorders, polyuria, oliguria, dysuria, incontinence, anuria, hematuria, hemoglobinuria, pyuria, chyluria, albuminuria. This is generally in the ladies after 45 years and gents after 55 years. Everybody will get this one. We have to control it. Albuminuria, prostatitis. I think all our senior citizens are having this one. Next, renal calculi. Because of this modern way of living, everybody is getting some renal calculi. After that, cystitis we have taken. With this, our all urinary troubles and problems have gone. And in that, we have to remember epismel is the most important. After that, cantharis, because simple points I am telling. Epismel, cantharis, and equisetum, lycopodium, sarsaparilla, Berberis vulgaris, Pereira breva. These things you must be very important. Read this one. Nearly 8 to 10 drugs are there. Most important, we can give it that one, and we can reduce within 5 days to 10 days whatever the urinary problems are there. So with that, our urinary problems classes are over. From today onwards, we will take menstrual disorders. In that menstrual disorders, we will one by one we will take from starting from pregnancy. Most probably I will take after 2 weeks. Now, a lady, naturally they will get menses for every month, 28 days to 32 days. Menses, the blood and other material discharged from the womb during menstruation, which is flow of blood from the uterus once in a month in women of childbearing age. It commences about the age of 13 years, that is nearly puberty age, 13 to 14 years, and ceases about 45 to 48 years. Certain people will get 52 also. The menstrual cycle is governed by the hormones from the anterior pituitary gland, thyroid and ovaries. All these glands, we must keep these glands, preferably ladies, by doing certain exercises. Why I am telling exercises means, previously our Surendra sir has told about traditional habits. Previously, ladies are generally doing so much of household work. Sitting, doing clothing and washing clothing and doing so much of kitchen work and everything by sitting on the ground. By that way, they will get till menopause time, they will not get any problems, general problems. Even at the 60 years also, slowly they may get knee pain or back pain something. Nowadays, at the age of 30 itself, we are getting all the pains. New pains, the newly named pains also we are getting. So, exercise is the most important. Nowadays, we need not go for a gym or like that. Yoga exercises we can do. And sitting on the ground is the most important. Whatever the work we are doing, preferably ladies and gents also, sitting on the ground is most important. Because bending of our all joints are important. It's by sitting in the chair we are bending only thigh, area and knee area only. The remaining areas we are not at all doing. And there must be backward bendings also. Slowly, by sitting in the chair itself, simply backward. By that way, vertebral column will be strengthened. So, little small exercises by sitting in the chair itself we can do. But we should not avoid exercise. That is most important. Pituitary gland is about the size of a pea, PEA, and hangs down from the base of the brain. I think all these things our Anup Kumar has taken, but I am giving simply high school student. The front lobe of the gland secretes several hormones like TSH, ACTH, which stimulate adrenal and thyroid glands and stimulates the production of sex hormones and milk. The posterior lobe of the pituitary gland secretes diuretic hormones of ADH, which stops the production of excessive amount of urine. The pituitary gland is the most important gland in the body because of hormones it secretes controls the functioning of other glands. Next, ovary is coming. One of the two generative reproductive glands in the female, which is produces ova or egg. Ova or egg cells and secretes the female hormones estrogen. Fallopian tubes are the two tubes that connect two female ovaries to the uterus, through which ova or the egg cells travel to the womb. In other words, these tubes convey the ovum from the ovary into the uterus. These tubes commences from the sides of uterus, open into the pelvic cavity, that is lower abdomen cavity near the ovary. These notes I will send after 1 week. Whatever, because it is theory totally. In this, actually I don't want to go to any disease oriented now today. Ovulation is the process of releasing the matured ovum or eggs from the ovary midway in the menstrual cycle, about 14 days before or start of the period. The best time for easy conception or the pregnancy is between 10th and 20th day. Exactly it is coming at 13th and 17th day, but generally 10th and 20th day. And menstrual cycle is there. This menstrual cycle generally it will occurs every 28 days to 32 days. It lasts 3 to 5 days depending upon their constitution. It occurs every month from puberty to menopause. If the pregnancy occurs, the proliferated mucosa becomes converted into placenta. If the pregnancy does not take place, the hypertrophied mucosa breaks down and discharges as menstruation. And there are stages also in menstrual cycle: first stage, second stage, third stage, and fourth stage. These things, while discussing about the diseases, I can tell, because now it is a very dry subject. Womanhood, generally if you take womanhood, pregnancy is the most important. It is a motherhood. Pregnancy is a proud moment of any woman. This stage is fulfillment of her sweet dreams. It should never be viewed as a burden nor accepted reluctantly. In the first pregnancy, the woman has to pass through a totally novel experience in her life, and there could be multiple problems prima facie. But the multipara, she will be experienced a woman who can weather any storm. And common symptoms of pregnancy: stoppage of menstrual flow, hardening of nipples and change in the color of areola and area around the nipples, heaviness as the pit of lower abdomen, occasional vomiting and nausea, pain in the back or loins, dizziness and continuous headache will be there, sadness, depression, anxiety, lowness of spirits, and sometimes because of fears. Different people will tell different things. Nowadays WhatsApp messages are coming that will kill any person, even male or a female, that will kill. They will tell even doctors cannot teach that much, WhatsApp will teach. The certain disease will be there, for that allopathy is this much, homeopathy is that one, and Ayurvedic this one, like that. So many medicines they will give. other people without asking anybody, simply they will take and eat. And in this Facebook and the WhatsApp, 50% they will give good information. The 50% they are giving spoiling the persons. Complaints and diseases, disorders during the pregnancy, excessive vomiting, at that time only we have to go to a doctor. General nausea, we need not go for anything. And albuminuria and constipation, sometimes diarrhea also. Complaints in the mental side, undue depression, morbid fears, sleeplessness, effects of fright, anger and irritability. This pregnancy time, generally, if in the house, we should not give any torture, tension, turmoil to the girl, the lady. So much, totally the other persons who are staying in that house must love her totally. Love her and give good information to her. They should not spoil her mind, because that is a crucial time. That 6 months or 7 months, very, very crucial time. She might be very enjoyable mood. Physical symptoms may come, but mental symptoms we should not create. Duration of pregnancy, it is 40 weeks. That is 9 calendar months reckoning from the last menstrual period. For this, we have to keep our mind in a proper manner. And while pregnant lady, we should treat very, very, very cautiously. We should not give just like that whatever the medicine available. When that lady is getting anger and irritability, we can give Sapia weekly once or twice in 30 potency. Generally, acute conditions, aconite is sufficient. Aconite and belladonna in 30 potency, that is sufficient. And preferably for these people, Califos is the most important in 6x. That can take daily 1 or 2 doses continuously. Otherwise, bio number 26 is there. Easy parturition. That is commonly after 4th month onwards till delivery we can take. That is the most important. With that, Califos is the only medicine that will tone up her mind. Unnecessary fears will not be there. Good sleep will be there. And take it easy policy they will follow. Provided the surrounding people also have to be like that. And any contradictions are there, or anybody is scolding or anything, any dwelling of bad thoughts or anything, at that time ignitia we can give, IGNATIA, ignitia. And any fearfulness is there, why I have to live, why I have to do, why this pregnancy, I don't want this, like that is there, means we can give 1 or 2 doses of Aramid. When sleeplessness is there, same Califos will work excellently. And Passiflora incarnata, that we can give 10 to 15 drops daily. And Coffea cruda is one of the medicine that also sometimes weekly twice we can give. Because the Coffea cruda, sometimes sleep will not come because of anger or because of fear or because of so much of happiness also. Different. At that time Coffea cruda will work. And sleepless due to mental strain or thinking of so many points, then you can give sometimes Nux vomica. But Califos is the only medicine available to pregnant ladies continuously to keep their mind calm. And bio number 26 to boost that one. At the time of puberty until marriage time, how we are giving bio number 15 for starting stage of menstruation, how it will work excellently, like that 26 will work excellently. Argentine natricum, if any fear is there, we can give Argentine natricum. Anticipation of something will happen, like that. And if depression is there, aconite itself will work. Sometimes we have to give alfalfa in tonic wise or mother tincture wise. Avena sativa, passiflora, to make the calmness in the mind, we can give that one. And any palpitation is there, any fear is there, any chest points are there, means we can give Cratagus drops along with Aramid. So with this today I will stop that one. Next week, because I am having some important work, so I'm taking leave from you. So again I will meet you on 12th. 12th, from 12th onwards I will come regularly and do it. Okay, thank you very much, sir. Anup Kumar sir, you can take, because
Thank you,
next
thank you.
Sunday my mother's 100th birthday.
Yes, sir.
We want to celebrate that.
Yeah, we all pray for that, sir.
Thank you,
Let
thank
everything
you,
go
thank
well.
you, thank you.
Suresh sir is there online. Suresh sir,
Suresh sir is there. Suresh sir,
yeah.
yes.
Yes,
So
I am here.
You can
Yeah.
take, sir.
Can we go?
You start, sir.
Uh, Anup is audible to everyone?
Yeah, it's audible.
Okay. Very good evening to all the group members. Last Sunday we finished a different type of sciences, medical sciences applied for curing a person or diseased person. We have seen as per organon. Today we will enter into the next chapter of the organon, which is known as aggravation and amelioration. It is very important from the point of view of practice, our clinical practice. So let's go into the detail of this aggravation and amelioration. Let's begin with aggravation. Aggravation and amelioration, they find its place under the head called modality. So under the head modality, these two terms, aggravation as well as amelioration, they come under this section. While formation of the picture of the patient, or while forming the picture of the complete picture or the grand picture of the patient. I mean, the complete picture or grand picture means it includes location, it includes sensation, it includes modality and concomitant. So these four put together known as grand symptom or complete symptom. So aggravation and amelioration, they come under the section or the topic of modality when we take case taking, and when generally we take the complete symptom or the grand symptom. So aggravation is a condition explaining when or what condition the patient as a whole is worse. Patient as a whole is in worse condition or worse situation, and the exact time, the exact season, the exact circumstances the patient experiences the intensity of the complaints very stronger and high in degree. This is known as aggravation. I repeat, it is a condition explaining when or what condition the patient as a whole is worse, or patient whole is in bad state, and we would like to know the exact time, exact situation or season or the circumstances in which the patient's complaints or patient's symptoms are of very stronger nature or high degree in intensity. So this is known as aggravation. Now coming to the exactly opposite situation is your amelioration. Amelioration is a condition explaining when and in what condition
the patient as a whole, as in total, he feels comfortable, he feels better. So it is also known as exact time or exact season or exact circumstances when the patient experiences the intensity of the complaints receding or disappearing or weakening down. So this is known as amelioration. So it is on the whole when the patient feels betterness or feels better with reference to his health status or his symptoms status. So it is exact time, exact season or exact circumstances when the patient as a whole experiences the intensity of the complaints disappearing or receding. On the whole, it is weakening down. So in generally patients, in amelioration situation, patient says, they say, doctor, I am better, I feel better than earlier. So these are the terms used by them in a such situation. So this is the definition of the aggravation and amelioration. Now let's go to furthermore into aggravation, and let's know what is homeopathic aggravation. We are more into this because we'll come one by one. What is medicinal aggravation also we'll know, but we are more interested as a practitioner. We must know what is homeopathic aggravation. Then our task becomes easier. Our case taking or on the whole, the prescription, second prescription follow-ups, all becomes easier to us. And we also come to know on the whole, the status of the patient as a whole. So homeopathic aggravation is a short and sharp aggravation. Homeopathic aggravation is a short aggravation as well as it is a sharp aggravation of the existing complaints of the patient after application of the well selected remedy. This is known as homeopathic aggravation. I repeat, homeopathic aggravation is a aggravation of a short duration but with sharp aggravation, with sharpness also, in aggravation of the existing symptoms of the patient after application of the well selected remedy, or rather we can put it as a similimum. So it's a short aggravation with sharpness also. Deep, what's called, when we look into graphical picture, will be sharp in nature. It will be a graphical picture will be 60-degree angle. That picture, graphical picture will be representing. So homeopathic aggravation is a sharper and of shorter duration after administration of the well selected remedy. Now why this homeopathic aggravation? Let's see into the light of the organization. So for knowing this, we have already studied what is primary reaction, what is secondary reaction, and what is secondary curative reaction in our earlier classes also. We have to keep a track of that also. We have to remember that also. What is primary reaction, what is secondary reaction, and what is the secondary curative reaction. So let's go into it. So after administration of the homeopathic remedy, there may be chances or there is a probability of a homeopathic aggravation, or rather on account of the primary reaction of the homeopathic medicine. I repeat, on account of the primary reaction of the homeopathic medicine, there will be increase in the symptoms of the original disease is perceived. So what happens whenever we administer the homeopathic medicine, we have seen in primary reaction, there will be a conflict between the medicinal force and the disease force. That is, whenever the similimum remedy is applied, then they conflict each other, and because of this primary reaction, we administer the drug of similimum in character and higher in potency, higher in degree of intensity, or higher in dynamic in nature than the disease force. So we have to ascertain that what is the quantum of the disease force, what is the what is the status of the disease force, dynamic condition of the disease force. Based on that, we apply the dynamic medicine. When we apply the dynamic medicine, greater in force, greater in quantum than the medicinal force, then obviously there will be sharp aggravation on account of the primary reaction, and this is known as a homeopathic aggravation, sharp aggravation of the existing symptoms of the disease status. So it occurs, usually this occurs, homeopathy occurs within first few hours after the administration of the remedy, or within a day or in a day. We can see within few hours or in a day we can perceive such type of sharp aggravation, particularly in case of the acute diseases. Whenever the disease is of acute nature, then this sharp and shorter interval of aggravation is perceived because of the acute characteristics nature of the disease condition. But when the medicine takes a prolonged action, because in acute condition we give acute class of remedy of a higher dynamic power, but in case of chronic diseases, when we administer the constitutional remedy, or when we administer the miasmatic remedy, in such cases the medicines have a longer duration action, prolonged duration action to fight out the disease force for a considerable time or for a longer period of time. So in chronic type of diseases, when we administer the acute chronic class of remedies or constitutional remedies, then after administration of one dose, we may not perceive the sharp reaction. We cannot get the sharp reaction in a few hours or in a shorter interval of time, a day or so. But with the passage of time, the homeopathic aggravation occurs from second day onwards till 8th to 10th day. Normally, this is the period that this aggravation, homeopathic aggravation, is perceived in case of chronic diseases from second day onwards, and it may be perceived on the 8th or the 10th day also. So this is the difference between the acute aggravation and the chronic aggravation on account of the homeopathic aggravation factor. So in case of acute class of remedy, acute diseases, when we administer the acute class of remedy with higher power, then there will be short and sharper aggravation is perceived within few hours or in a day. But when a chronic diseases, when we apply the constitutional remedy or remedies of higher power in a single dose, then it takes a little longer time to perceive the homeopathic aggravation. So after second day or third day, from there onwards till 8th day or till the 10th day, this aggravation, homeopathic aggravation, is perceived in the chronic diseases. So, and in an antisoric remedy, often they show a very slow aggravation in the first few hours, and they in the later part of the period, and after few hours of the day, or probably 5th day or 6th day onwards, there is aggravation is perceived. So I have explained the homeopathic aggravation in case of acute condition of the patient or acute diseases, and how the aggravation happens in case of chronic diseases when we administer the constitutional remedy of, or otherwise single dose of higher power in chronic diseases. So this is basically aggravation, homeopathic aggravation in the light of the organelle. So let's look into the mechanism of this aggravation. First, the homeopathic medicines are potentized. They are in they act in a dynamic plane, and they are powerful, and homeopathic medicines are potentially always greater than the natural disease power. So that's why they are capable of liberating the vital force from the clutches or clutch of the, or from the captivity of the disease force. So in order to liberate the vital force from the hands of the disease force, captivity of the disease force, we administer the higher power medicine. So the medicinal potentiality, the medicines, potential medicine or dynamic medicines, they act unconditionally. They act unconditionally for all the times, all the seasons, and all circumstances upon all the persons of different race, different regions. So that is another plus point for this. So homeopathic potentialities, they act universally, unconditionally, all the times, all the seasons, all the circumstances, upon all the people of different race and of different regions of. And further, we also pick up the simillimum remedy. So similarity between the two morbid pictures, that is, one morbid picture is disease picture, the another picture is your medicine, the drug picture. So then when always we have a simillimum between the drug picture and the disease picture, and by this application, simillimum application, so the medicine work in a dynamic plane and fights in a dynamic plane with the disease force. So with the administration of the higher potency and higher dose of the medicines, the disease force gets liberated out of the hands of the vital force gets liberated out of the hands of the disease force. And over a period of time, since the our homeopathic medicine has a periodicity, limited periodicity of action, so later on, over a period of time, once the vital force is relieved of captivity of the disease force, then vital force is free to function in harmony, as well as the disease medicinal force ebbs away. The intensity of the medicinal force ebbs away in a shorter duration of a time. So that's why we see the medicinal aggravation, homeopathic aggravation, in a shorter duration with a sharp in nature. So this is about the mechanism of the homeopathic aggravation. However, this primary aggravation can be minimized when we adhere to the basic principles of homeopathy. That is, when we adhere to the law of potentization and law of minimum dose. So when we understand the law of potentization and when we understand the law of minimum dose both together, and we apply into a practicality, then this primary aggravation or the primary homeopathic aggravation can be averted or can be minimized. So whenever there is a minute dosage is applied, apt dose, what is called minute dose, it will not lead to any kind of unwanted homeopathic aggravations, and unless until the patient is idiosyncratic. So when the patient is idiosyncratic, then obviously there is a chances of other homeopathic aggravation, sharp homeopathic aggravations are perceived. But when we adhere to the law of potentization and law of minimum dosage, then obviously this homeopathic aggravation can be averted or can be minimized by our application methods and techniques. So this is about the application and about the how it happens. Homeopathic aggravation happens on account of the conflict between the medicine force as well as the disease force. Now, significance. What is the significance of this? So whenever there is a first important significance, whenever there is a homeopathic aggravation occurs, it indicates that we are approaching towards a cure. We are nearing the cure, or rather we are on the right path. That is, we are approaching cure. That is the indication. After the initial aggravation of the patient, patients feel betterment, feel better, and improvement is subsequently followed. So the first significance is indication of that we are approaching cure. This is one important indication. Then the second indication is good prognosis is also possible. We can do good prognosis, and we can subsequently have a proper selection of the proper prescription of second prescription. I mean to say, once the first prescription done, how to do second prescription, that poses a difficult task. But when we follow this, once the homeopathic aggravation happens and homeopathic aggravation is weeded away or minimized, then we are able to decide what should be our second prescription or a follow-up prescription. So prognosis also becomes easier for physician. Then also third point, it indicates the correct selection of remedy also and correct selection of potency. This is also very important. Correct selection of remedy and correct selection of potency also. Then this also confirms the Hering's law of cure. So we'll go into the Hering's law of cure later on. Specifically, there is a 4 laws are there in Hering's law of cure. We'll see extensively that also. But once there is a homeopathic aggravation and later on the patient feels better, patient feels happiness or improvement in his status, then it is confirming the Hering's law of cure. So this is also a significant indication for our clinical practice. So on the whole, these 4 points are very important. First I said we are approaching the correct cure, correct prescription is there. Second, good prognosis is revealed, and it paves way for the good second prescription, perfect second prescription, and it confirms that we have chosen the correct minimum. And fourth, that we have adhered to the Hering's law of cure. So this is the indications of this, or rather, it is a significance of the homeopathic aggravation. So having seen this, the importance of homeopathic aggravation, let's do some more interpretation about the homeopathic aggravation. So Doctor, when this, what I am going to now give you interpretation of the homeopathic aggravation in various types of situations or various types of after effects of the medicine. It has been given by 2 masters. One is Bodger Boninghasen, this great homeopath. They have given this. Also, Kent has also given his observations. So we'll take up the Kent's observation as a separate chapter. But here, I would like to give you the Bodger Boninghasen's interpretations as per their characteristics repertory. There is a leading repertory is there, and in that repertory, this interpretation of the homeopathic aggravation is been well defined. The first, point number one, if the Bodger and Bonninghausen, they have said, the first point, if the aggravation is long with a decline in patient strength, then the case is incurable and it can be only palliated. This is the first conclusion or the first inference indication given by Bodger Bonninghausen in their repertory. I repeat, the first, if the aggravation is long with a decline in the patient's inner strength or vitality, otherwise we can say the case is incurable or it can be only palliated. This is the first indication Bodger Bonninghausen has given. The second indication with reference to aggravation. If the aggravation is too long with very slow improvement, then Bodger says is a borderline case. Prognosis is good, but remedy not to be soon to be repeated. That is, we have to wait and watch. So the second indication says is that aggravation is too longer and the improvement is also slow, then it is a borderline case. And though the prognosis of the remedy is good, prognosis of the case is good, and it should not be, remedy should not be repeated. We have to wait and watch till the improvement is seen and a right appropriate moment for the second prescription comes. So too long aggravation, we have to wait and see what happens. So we should not change the remedy and invite the complications. So this is about second point. The third point, which Bodger and Bonninghausen said, if the aggravation is too short and violent, aggravation is too short and violent, then patient has, as well as the patient has got enough strength and vitality, then they say is the best result which is indicated. So a short aggravation, a violent aggravation, but the patient maintains his vitality. There is no decline in his vitality, or patient strength is maintained, then they say the homeopathic prescription is the best prescription or best result is indicated or the best result is followed. This is the third indication. The fourth indication, in case of if the quantity, they say if the quantity and the quality of the remedy administered are exact in proportion to the quantity and quantum of the disease force, then it will lead to ideal cure without any aggravation. But it is seldom seen, but very difficult to be seen in practical condition, because we cannot assess the disease force quantum easily. But sometimes in our clinical practice, if our judgment is correct, our evaluation is correct, our assessment is correct, then in this situation can happen that when the quantity and quantum of the medicine remedy administered is equal in proportion or exact in proportion to the quantity and quantum of the disease, then it is the most ideal situation, and it brings without any cure is brought on without any aggravation. So it's known as ideal cure. It is known as ideal cure. But very seldom, we see this type of cure very not frequently. Normally we come across with homeopathic aggravation if right remedy is chosen, right similar is chosen. The fifth indication, as Bonninghausen and Bodger has said, if there is immediate amelioration, rather than aggravation, there is immediate amelioration and followed soon with aggravation, then it is indication that the case is incurable. I repeat, when there is immediate amelioration and followed with amelioration is followed with soon with aggravation, then the case is incurable. There is a fifth indication given by the Bodger Boringasan. Then sixth indication. The sixth indication, if there is too short an amelioration followed with a pronounced aggravation, then it also proves it is a incurable state, especially in case of chronic diseases and where the psoric cases, where disease is very adamant or disease takes a longer period to cure, then such type of situation can be apprehended. So if too short an amelioration followed with a pronounced aggravation, it will prove to be incurable, especially in case of psoric cases. This is the sixth indication. The seventh indication,
No, sir.
if a full-time amelioration of symptoms occur with the increase in the strength of the patient, and there is a vitality is too weak for restoration of apple, then this situation happens when the vitality of the patient is very weak and restoration of health becomes very limited. Then in such case, the full amelioration occurs without increase in the strength of the patient. This is the seventh indication. The eighth indication, the patient develops symptoms of the remedy, whatever remedy is prescribed to him, he gets the medicinal symptoms introduced in them without any improvement in the disease. Whatever the medicine we administer, first medicine is given, we see the aggravation of the symptoms and no amelioration in the symptom at all. So aggravation is also seen. And every time the medicinal symptoms are being also produced in the patient. So here the Boringasan says that the case is hard one, tough one, and rigid one, and this situation is seen in idiosyncratic patient. We have seen the idiosyncrasy earlier, and we know that what is in the idiosyncratic patient, to prove all the remedies whatever given to them. So whatever remedy it is given, they start proving the remedy. So in them, whatever remedy is given, the medicinal symptoms have been projected in them, and we see the aggravation as well as the medicinal symptoms. Medicine, that picture is also produced in them. So this is in case of idiosyncratic patient. Whatever the medicines we choose or give, in them the medicinal symptoms are being perceived. Then if the old symptoms, the last one, as Boringasan said, if old symptoms appear without any aggravation, if old symptoms appear without any aggravation, then one has to wait, because one has to wait. They say that the Simlimum has been applied and Simlimum has been administered and suitable remedies chosen, and we have to wait and see the action further. So, and if at all later on, otherwise a suitable repetition needed in such cases. A suitable repetition of the dose is required here, it indicates. So when old symptoms appear without any aggravation, then Dr. Boringasan advises one has to wait and so see the administered remedies action, and probably we have to give the choose a remedy and we have to repeat the dose, probably in a same potency or probably in a higher potency. So we need to repeat the dose in such scenario or such conditions. So this is all about the 9 conditions or 9 situations where homeopathic aggravations have been interpreted by Dr. Bonigasan and Dr. Bojar together. So I have fairly given this 9 point, but don't worry, I will circulate this short note about this because it is very difficult to remember. Difficult to remember through this, but I will certainly give the short note about this, about this 9 circumstances which has been talked by Bojar and Bonigasan in their repertory. So this is all about the interpretation of the aggravation by the Dr. Bonigasan. So this is all about homeopathic aggravation. So I have given what is homeopathic aggravation and why this homeopathic aggravation occurs in the light of organon on account of the primary reactions between the medicinal force and the disease force. Then how this mechanism occurs, and then how it can be prevented by adhering to the law of potentization, law of minimum dose, and their significance in clinical conditions, and the interpretation of this homeopathic aggravation by the pioneer Dr. Bojar and Bonigasan. So I have completely given the picture about this homeopathic aggravation. So I pause it, I give a pause to this, and with this we'll go into the next chapter, medicinal aggravation, in our next class. So we will take up the next chapter, medicinal aggravation, in our next class. Over to Dr. Anup and Dr. Murthy.
Thank you, sir. Thank you, sir. Murthy, sir. I won't have enough time to take a session now, so I think we'll take it for the next class. Murthy, sir, if there is anything, we can have a discussion or we'll close it, sir. Murthy sir is not available, I think. He's online.
Dr. Murthy is not there, then we will go for question and answer session.
Yeah, we can have any question and answers and we'll close it after that.
Yeah.
Any questions if you have, please ask. We'll try to answer you. It's already 5:23. If there is no much questions, we will wind it up, Mr. Suresh, sir.
Any questions?
Any question? Some questions. Some relevant or irrelevant. Ask some questions. Homeopathy answers everything.
Yeah. So I think we'll wind up. It's already 5:25 already.
Okay, if we don't have any questions from our participants, we'll close the session.
Yeah, we'll see you next time. Thank you all. Thank you very much.
Thank you all.
We'll meet for the next class. Yeah, next class I will take my sessions, okay?
Why professor is not coming?
Thank you all. Thank you.
Professor.
I think he may be traveling. We'll ask him next time.
Thank you, thank you.
Yeah. Thank you. Thank you.
Thank you.